Hi, this is Junaid, Neurological Care Stroke and Epilepsy Specialist. In this lecture, we're going to discuss a brief guide on ERAS application. The first thing you need to understand is that this is not a CV, this is not a resume, this is an application. What's the difference? So a CV is a complete biodata of your life. You put in all the details, including gaps. So for example, if I got sick or something and I say that I was in the hospital for 3 months, you have to put in there so people know what happened in those 3 months. And you're basically reviewing the whole life, your professional life in one document. A resume is a 1 or 2 page summary. So in that resume, you're not writing your whole data. You're basically writing the highlights of your professional life. So CV, complete professional life, resume, highlights of your professional life. An application is different. An application is something that comes to you in terms of a standardized format. It has drop-down menus, it has check boxes, and it has areas and boxes in which you have to put the format in which they asked you. And the reason behind it is standardization and consistency. So it's very extremely important that before you submit your ERAS application, you print it out and review it on paper. Why? Because program directors do so. And there's a difference in between how it looks on the screen and how it looks on the paper. So make sure that you print it out and make sure you edit it after on the screen as good as it looks on paper. Extremely important. Do not forget this. So let's get to it. So one of the major things that you're going to be asked to do is input your experiences: work experience, volunteer experience, and research experience. These are the 3 categories. And then you have to select different drop-down menus, as I suggested, as part of an application. So when you have selected your experience, then you look at the position. And the position is that sometimes you don't have one. Now, there are tons of medical students that have worked with me and they have contributed to my work as well, and I didn't realize that they really needed a position, because in the ERAS application you have to title a position, and this is not something that you can write. It is an optional statement that you have to do. This is something that you have to write. So go back to the person you have worked with and ask permission that you can put in a title, suggest a title, and sometimes it's just like research associate or research fellow or research coordinator, whatever that may be. You have to give yourself the title so that you can put the experience in. So it's important. And if you did not get an identified role, go back to your mentor and ask permission so that, can I put this in the application as this title? The second thing is you always want to include things that you have at least worked 10 hours per week in about 4 to 8 weeks or so. Because if you're going to do smaller than that, then again, this becomes a really odd thing that you're putting everything in your application and it's not really worth mentioning. To make sure that you are doing the activity that is profound enough to be added into the application, and just don't put anything and everything in the application, in my opinion. Lastly, the most important thing is description box. Do not repeat the information, because we already are seeing that information on top. That's why printing is so important. Don't repeat that you worked 10 hours a week. Don't repeat this was a research experience. You can repeat the position title, because that's something that sort of has to tie together within the description box. But try not to repeat stuff that is already in the check boxes. Remember, this is an application, so it's going to come out in a way that we can see it, and all that information will be reviewed first, and then we're going to get to the description box. Do not leave it empty. What you should write in the description box is 2 things. Again, you're describing an experience. Remember, an experience. An experience is something you go and do and figure out, and it's a life-affirming thing as well. So what you did and why you did. So I worked in the position doing X and learned Y, or I experienced this while doing this. So those are the key things that we're looking for. We want to make sure that during that experience, you learn something as well. So the description box is not just to say that, to clarify what you did, but again, clearly position titles are sometimes invented. So therefore you have to make sure that people understand that what you did exactly. So for example, research coordinator. Did you manage a clinical trial? Did you go ahead and interact with patients or not? Did you just did database analysis, database maintenance, or did you do some data analysis as well, etc., etc.? So put that in the box that this is what I did, and this also increased my research skills, etc. So this way we exactly know what you did. And max length is, people write a lot of stuff in it. I think that this is important that you try to make sure that this is not too long, because it's harder for us to really read paragraphs and paragraphs. It's important because we have to read your personal statement, your letter of recommendation, which is the first 2 things, and then we're going to the application as well. So the idea is that the max character should be 550 to 600. It's basically the length of 2 tweets. So So in the first tweet you're writing, I worked and then why I did, and therefore that should be good enough in terms of description, and try to make a more succinct way of writing in this particular way. If it has to be longer, it has to be longer, but try to be more succinct. And make sure you're consistent, both in terms of formatting and in terms of reviewing it on paper. If you're using bullet points, then use bullet points all the way. If you're using prose as paragraphs, then use prose and paragraphs all the way. Do not be inconsistent. That's basically also when you're reviewing an application, that really throws you off, and your viewability of things become a little off as well. So that's why reviewing on paper is extremely important. This will be part of the Getting into Residency guide, which me and Danish Bhatti are developing together. And the first course is going to be online soon, a guide to choosing a medical specialty. So please make sure you go to AINeuroCare Academy website. If you save a life, it is as if you saved the life of mankind. Please make sure you like, comment, share, and subscribe to my YouTube channel and my newsletter. If you want to get in touch with me, the best way is to go through Twitter or via LinkedIn. Also, make sure you follow the Academy website for regular updates. Thank you so much.